month, we celebrate the 100th anniversary of the 19th Amendment, which guaranteed women's right to vote. Passed by Congress in 1919 and fully ratified in 1920, the 19th Amendment became a part of our national Constitution after decades of protest and struggle. The passage of the 19th Amendment did not, however, ensure suffrage for all women, as Native Americans did not gain the right to vote until they were granted U.S. citizenship in 1924. Asian Pacific Islander Americans did not gain the right to vote until 1952. And African American and Latinx Americans suffered voter suppression tactics that disenfranchised them until the Voting Rights Act of 1965 and the 1975 expansion of the Voting Rights Act. Even today, voter suppression is a real concern, and the right to vote for all people, including and especially people of color, is one to be guarded and protected. Much like the right to vote was first only granted to white men, mental health care has also historically focused on white, straight, cisgender men as the standard upon which care was based, with little acknowledgement of any group that differed. Yet that standard is changing. After all, if women and gender-expansive people comprise over 50% of the population, should gender-responsive and reproductive mental health really be considered a specialty? 1 year ago, I had the privilege of joining DMH as the first Associate Medical Director for Women's Health and Reproductive Psychiatry. With the support and guidance of other DMH leaders and staff, we are just now beginning to shine a light on issues that disproportionately affect women and gender minorities. We are creating trainings on mental health and pregnancy and the postpartum, diving into conversation and research with providers and clients on how to ask about reproduction and mental health visits, and forming relationships with other agencies focused on gender-specific health, such as the Department of Public Health's African American Infant and Maternal Mortality, or AIM initiative. Also, DMH has hired its first ever LGBTQ+ services specialist to help make DMH a safer and more affirming place for clients, as well as staff, of all sexual and gender identities. These are just beginning steps. Like the journey to true inclusion for all women to vote took over 50 years, we have a long road ahead. I am so proud to work for an organization as diverse as DMH, where women make up a majority of the workforce and LGBTQ+ staff serve in many capacities.